the Secretary to the Government of the Federation, Honourable Ministers here present, Director Generals, Directors, ladies and gentlemen. Much of what I will say today may sound familiar, but the issues around COVID-19 do bear repeating because of the emphasis that they require. As of today, the 15th of April 2020, 373 cases of COVID-19 have been confirmed. 99 cases have been treated and discharged, and unfortunately 11 deaths have been recorded in Nigeria. It was 30 new cases that were reported from 5 states. Lagos 25, bringing the total there to 214. FCT 2, Akwa Ibom 1, Edo 1, Kano 1, and the only additional fatality was in Lagos, a 63-year-old person who self-presented at the infectious disease hospital. There are now 12 functional COVID-19 testing laboratories with a capacity to test samples of about 1,500 daily. To ensure maximum utilization of our increased testing capacity, the case definition and testing criteria have been expanded to include not only contact of confirmed COVID-19 cases with fever and respiratory tract symptoms, but also all persons with fever and respiratory tract symptoms of unknown cause. The imminent advent of community transmission marks an evolution of our initial strictly containment strategy. Risk communication to the public and coordination with the state-level COVID-19 response preparedness groups are going to be scaled up. There is also an increased drive to detect cases more rapidly, especially in hotspot communities. All persons fitting the case definition are advised to first of all wear a mask of any type, isolate themselves from friends and family while they call national emergency number 112 or the NCDC toll-free number of 0800-97000010 or report to the nearest health facility for referral. The policy is to detect early, test early, and isolate cases as early as possible. I again remind all health workers in both public and private health facilities to maintain a high index of suspicion and to safely refer patients with fever and respiratory tract symptoms for COVID-19 testing. Safely refer here means that you offer a mask or some protective barrier, if possible, to the patient or the person and invite the person to a holding room if you have one, and then you call 112 or 0800-970010. A guideline has been produced by the Federal Ministry of Health Accreditation Committee to ensure that standards are maintained at all COVID-19 isolation and treatment centers across the country. There are 3 levels of isolation. Isolation 1 for suspected cases of COVID-19 who are awaiting test and result. This center will also be designated the mandatory quarantine facility for persons returning from abroad with negative results, or those unable to self-isolate at home for 14 days. Isolation 2 is for confirmed COVID-19 cases with mild or moderate symptoms who need little or no clinical management and only need to be isolated from community for the time they are infectious. Isolation 3 is for confirmed COVID-19 cases with severe or critical symptoms who need enhanced clinical management or intensive care. In Abuja, for example, the designated Isolation 3 facilities are the University of Abuja Teaching Hospital and the National Hospital. There are 4 Isolation 2 centers. I appeal to citizens to comply with invitations to isolation centers. This is your best option of recovery and for detecting possible complications in time. I wish to thank the professional health associations that have pledged their support in filling health human resource gaps. We have met with the Nigerian Medical Association, Pharmaceutical Society of Nigeria, the National Association of Nigerian Nurses and Midwives, the Medical and Dental Consultants Association of Nigeria, to position medical and critical care specialists for deployment as when needed. The Nigeria Center for Disease Control has now issued a comprehensive guideline on the use of masks, including improvised and homemade cloth masks or face coverings like handkerchiefs or scarves over the mouth and nose, which guard against particle emission even in conversation or when coughing or sneezing, and may offer mutual protection to the wearers. It bears repeating to again recommend that the masks be worn, one as an additional layer of physical protection where close contact or crowd may not be avoided with certainty, such as in a market, or when somehow or the other you find yourself in a crowd. They are particularly recommended for food vendors. Also, to wear masks will be elderly people or people with pre-existing medical conditions whose health condition can be regarded as fragile. I must emphasize that masks must be worn in combination, but not as a substitute for hand washing, physical distancing, and good respiratory hygiene, as well as sanitization of surfaces. Medical grade masks are best reserved for patients and health workers who need them most, especially with the globally limited availability of personal protective equipment. Citizens are encouraged to make use of improvised or homemade washable masks or face coverings, which should be properly washed daily in warm water and dried or ironed. Yesterday we received offer of technical support from the US CDC, already announced, and a large donation from the United Nations Agency of supplies and equipment that included 50 ventilators. This increases our inventory of essential equipment. The government of Nigeria thanks them and is grateful for such good friends and partners. Finally, I wish to commend all Nigerians for their sacrifices and the understanding as we work to ensure that we control COVID-19. The inconveniences that arise will be well worth it. With the present trend towards community transmission, the strategy of the health sector is being redrawn to address the specific challenges, and their emphasis will be increased towards screening, testing, and immediate isolation of confirmed cases. The advisories on non-medical interventions must be maintained, which have already been well publicized. Please continue to trust scientifically proven advisories and ignore fake news. I shall now hand over the desk to the Director General of CDC.